Okay, I'm back. I do have technical problems with my iPad and I apologize. So, we thought it would be fun. I thought it would be fun to do Friday night kayaking. And my husband and I went out for a sunset kayaking with a group of other people. And everybody was in their own little kayak, and I was behind. I could not catch up, and my husband kept saying, "Do what I'm doing," and I'm yelling, "I am." So in the end, they said, "Well, that yellow kayak that you had, that's kind of a lemon." So on another Friday night, we went out with a bunch of people, and it was a sunset cruise, and it was so neat. We got to see all kinds of wildlife and everything. But again, I am way behind, and I can't catch up. And finally, one of the volunteers came back to try to help me. I mean, I am way behind. And I said, "What am I doing wrong?" And she said, "You just don't have any oomph." It's the same sensation when you go to a bank or a store that has a big heavy door and people just come and open it up and go right through, and you're struggling. Your muscles are disorganized and they don't have that power. That's why when I see my little grandkids that have fibromyalgia trying to compete, they're not keeping up either. And it hurts me to see them have to go through this. So I was telling my husband the other day, when I was in college, I was like 29. But I mean, I was in shape. I'd go to the gym. I was interested in my health. I took jogs and everything. But I always struggled every day. I didn't know I had fibromyalgia. And you had to take 4 phys ed classes. And I was in tennis. And I remember at one point the instructor said to me, "You're a big girl. Now stop letting your team down." And I was just kind of speechless. Then when I got into badminton class, you had to really extend your arm up. And I liked the class, but my shoulder hurt so badly that I couldn't get my arm up. And I explained that to the teacher, but, he didn't really say anything. So 3 years later, almost 4, I go to this alumni event. And like I said, I would exercise, and I had my weight at a good weight. And I ran into the badminton coach. Someone, I think the president of the college, was introducing me to him, and he said, "Oh, I know her. She was the worst badminton player that ever came through my program." Let me tell you, tears were stinging my eyes. I thought, that's just mean. Later, when I figured out I had fibromyalgia, I understood. You're doing the same things other people are doing and not getting the results. Not only that, when you go to do something like tennis or ping pong or whatever, you get sore. You get sore from the repetitive motion. And why does that happen? Because your muscles have to make energy. So when you're low on energy, you actually take a walk or do something, and that makes more energy, which is called ATP. With fibromyalgia, you run out of energy, and you can't make anymore. You're out of it. Your cells aren't getting nourished. They're not getting the oxygen and everything they need. To make more energy, your body has to do it differently. And that builds up lactic acid, which makes your muscles hurt. So my son said to me a few years ago, "Mom, I'm getting this. I understand it now," because he was telling me that in addition to having insomnia, trouble sleeping, never feeling rested, he started going out running, jogging with his wife, and the next day he'd be wasted. He would go work out at the gym with weights, and the next day he was tired, his arms hurt, they felt tired. And then when he asked everybody else at the gym, they said no. He said no, because You don't know that you're not like everybody else. People with fibromyalgia have trouble getting shoes to fit. The heel tends to be more narrow. You have what's called a duck foot. It widens as it goes up toward the toes. A lot of people with fibromyalgia have a callus between the second and third toes on the bottom. For years, through medical school and residency, it wasn't until clogs came out that I had a pair of comfortable shoes. I was in misery working all those hours with shoes that were too tight, that left marks on my feet. So why am I doing these talks? Number one, to validate you. You're not crazy. You're not lazy. I remember one woman that came in and she said, Dr. Kirby, my husband tells me I just need to get off my lazy behind. So as I talked with her and interviewed her, it was clear that she had fibromyalgia. And when her husband came in, he said, you're my wife's best friend. He was empathetic toward her. If you don't have a spouse who understands the disease process, you know, I used to tell my patients, bring your husband in, bring your wife in. They need to understand. I had men with fibromyalgia working very physical jobs, and they didn't know how they were going to keep going. And they didn't want to lose their jobs. The job doesn't change. It is just as demanding as it was when you were 20 years old. People start going through their cupboards. Do I have ibuprofen? Do I have Tylenol? Taking all this stuff, trying to get rid of the pain. I met an older man this past year, and he told me that his wife died in the last year. And we were talking about her, and he said she had fibromyalgia, and she ruined her liver by taking too much, I think, Tylenol. And I felt really bad. I know that desperate feeling when you hurt so bad. Not only that, how you feel changes from minute to minute. You can be all dressed and ready to go out the door to a family event, and all of a sudden you have a horrible headache, or you have a severe muscle cramp. And I mean, those cramps are severe. They'll make you scream. They'll drop you to the floor. One thing is you need some support. Over my life, there's only been a few people that have said to me, oh, you have fibromyalgia, what's that like? Or my sister-in-law has that, and I know how she suffers. Something always hurts. And then what's worse, the fatigue or the pain? I've had people say I could put up with the pain if it wasn't for the fatigue, or I could put up with the fatigue if it wasn't for the pain. You have all these things you want to do, and you end up on the couch or on the chair. And people say, man, once I sit down, I can sit there for hours. I just can't make myself get up. But the more you rest, the worse you feel. Even my teenagers would say, you have to keep moving. So years ago, I signed up to do an all-day workshop, conference, whatever you want to call it, on fibromyalgia. I was a participating doctor at the local hospital, and year after year, they would send me these little cards to fill out saying, would you agree to be a speaker at the education center? What would you like to speak on? When are you available? So they never called me, and so I called them and said, I'd like to do a Saturday conference on fibromyalgia. Well, guess what? They didn't want me. Later, I thought, you know, when you look at all the doctors that do the talks, it usually brings in revenue for the hospital, like the doctor that does talks on arthritis. A lot of those people end up needing joint replacements. So I was a little bit upset because I felt like there was a need. Then they wanted to charge me $350 to use the building. So eventually I got that all ironed out. They, I think, felt bad that they were saying, well, every year we ask you if we want you to speak, but we don't want you to speak on fibromyalgia. So I advertised it on the radio station. I asked people to pre-register. It was a free event. We were offering lunch, and I had a massage therapist, I think a nutritionist, because diet is huge. And I want to do a podcast on why eliminating certain foods is crucial, especially gluten. And I had a physical therapist. I had a whole lineup. And we were each going to talk for about 45 minutes. So the whole thing was basically lasting all day, from like 9 to 4. I really didn't know how many people to expect. I think we had at least 25 people signed up. But on that morning, let me tell you, we had to open up a second room. There was at least 75 people there, some women, some men. The statistics used to be with fibromyalgia, 90% women, 10% men. Then it shifted to 85 and 15. But let me tell you, a lot of men are not diagnosed. So I opened up this seminar with some jokes and tried to lighten everybody up. But as I began to talk, a lot of people started crying. And they felt validated. They felt like I'm not crazy. I'm not losing my mind. I'm not a head case. They felt validated, and they needed a voice. They needed an advocate. I didn't know I was going to get emotional, because your spouse can feel like, what's wrong with you? One lady told me her husband said, where's the girl I married? And I remember fairly newlywed said to me one time, my husband wants to hike. He wants to do all this physical stuff. And I get tired and I hurt, and he doesn't understand, because we did those things when I dated. Or sometimes teenagers or children would get diagnosed because the family would go on vacation and they would do strenuous things like hiking or all day long, and the next day their child would say, I just can't, I'm tired, or I hurt. Or when little kids say, my back hurts, or my neck hurts, or one little kid said, I have a headache all over my body. You really feel bad. So over the next weeks, I would like to do talks and tell you, what to do, how to live, what helps, what doesn't help. And it can even be difficult to get a diagnosis. A lot of doctors, physical therapists, and so forth have told me that they feel uncomfortable with fibromyalgia patients because no matter what they seem to do, things don't work. And a physical therapist said, I seem to make people worse. I don't know what to do to help them. We have a local fitness center with a hot water pool and everything. I think if I tried that now that I've made diet modifications, that might work. But back then, even walking in a heated pool made me hurt so bad I could hardly get out of the car when I got home. So maybe you have muscle aches and fatigue, and there are other things that can mimic fibromyalgia, like Lyme disease. And it's important that you have blood work to make sure you don't have other things. It does seem funny that a lot of people with fibromyalgia may have a sibling that has rheumatoid arthritis or lupus. Maybe they're inherited together. But fibromyalgia often comes with other things too, and you need to know how to manage them, like reflux. And people with fibromyalgia, your swallowing muscles are affected too. So sometimes hours after eating, people can cough up phlegm that has the food they ate hours ago, or suddenly start choking, or their throat feels dry, and they don't really know what to do with it. But it's real, and it can be embarrassing when suddenly you start choking. And people have weight gain issues because they're inactive and they crave sugar, which is actually bad for them. And some people have sleep apnea, but there's an upper airway resistance disorder that people with fibromyalgia get, that they will snore or snort or do funny breathing things. And bruxism, which is clenching and grinding the teeth, I saw it in 100% of my patients. They may not know they were doing it, but I would look for these scars right inside their cheek where they bite down. They get a white linear scar there. 100% of people. I remember when I was in my 30s, I started getting terrible headaches every day, every day, every day. Nothing took them away. And when I went to the dentist said, "Do you grind or clench your teeth?" And I said, "No, of course not." "Are you sure?" I said, "Oh, yeah." That very day, I caught myself doing it. Well, when you clench your teeth at night, puts a lot of pressure on your facial nerves and all, and you can start getting headaches. And they hurt, and nothing takes them away. The only treatment is a mouth guard. Not only that, you can start to break teeth. You eat a sandwich or something, and all of a sudden you have a piece of a tooth in your mouth. I'll get into all of these things later. For now, I just wanted to do a little chat. And if you think you have fibromyalgia, maybe you have fibromyalgia. Maybe you know someone who does. Maybe your spouse does. And it can be a lonely world out there. My husband is great, but he has gotten so used to me just suddenly yelling, "Ow, oh, ah," that he doesn't even ask anymore. And the insomnia can be a terrible thing. Memory issues, they call it fibro fog. They have a name for everything: fibro gut, fibro fog. You can make a cup of tea and forget you made it, or go to the microwave to get it out and you already got it out, or you never put it in. The brain is exhausted. It's not getting the things that it needs, and it's tired. It's not functioning well. You can forget things, spell things wrong, go back over things you've written, and you will be shocked. Maybe you wrote house and you meant to write something completely different. Misspelling words. I used to string up necklaces, and I would have 2 clasps, one on each end, or my sequence would be off. You count on your brain to tell you when you make a mistake. And the fibromyalgia brain, nobody's home. It doesn't alert you. I've made checkbook mistakes, and it can really make you feel bad. And once you know that it's there, you understand. And of course you wouldn't want to miss something big. You need to know the difference. And sometimes even the doctor doesn't know. And the one question that people would ask me is, "Dr. Kirby, when am I going to know if this is something serious? I get terrible stomach pain. When am I going to know if it's something serious?" And the answer is, you don't. I remember one year I would move and I would get such severe pain in my shoulder that I would scream. And I finally went to the doctor. The shots didn't help, and finally it went away. Or you have severe hip pain. Well, one of my patients did need a hip replacement. The body, the fibromyalgia body, does not do well with healing. And I tried to talk people out of surgeries on their neck and back unless they absolutely needed it, because sometimes the post-op pain doesn't go away. I've had people have an operation and come in and tell me, I'm cured, I don't have fibromyalgia anymore. Well, I don't want to pop their bubble, and I don't know why it happens, because it does come back. But what I think happens is you never get actual sleep. You never get the deep sleep that other people get that refreshes you. And so you're always tired. It's like you haven't slept in years. And I'm wondering if when they put you out under general anesthesia, if your body, your brain, suddenly your whole body finally gets sleep and the fibromyalgia goes in remission for a few months. People are very disappointed when they find out they still have it, because there is no cure. There was a study to find out if people get better or worse or stay the same, and most people tell me that they feel they get worse with age. Also, you lose your emotional reserve to cope. Like, suppose you get a migraine twice a year. Well, it's pretty bad, but I mean, you can handle that. You can bounce back. Then what if you start getting migraines every month and they last 2 days now instead of a day? Now, this is a little bit rougher because it takes you a week to bounce back. Now, what if you start getting migraines every day? Fibromyalgia is kind of like that. Sometimes you just have an emotional meltdown because your emotional reserve with dealing with always being tired, always hurting, feeling socially isolated, just wears on you. And one night I just let out this scream, and my husband and I started laughing because he knew what it was all about. Back to the sleeping issues. Cortisol, your body puts out cortisol in the morning, and that's your get up and go. That's like your mojo, your coffee. I saw this funny post on Facebook that said every morning I say, be strong to my coffee. Don't drink coffee if you have fibromyalgia, please. I'll tell you why later. But with fibromyalgia, your cortisol levels go up at night. When you need them in the morning, they go down. I think that's why people with fibromyalgia have trouble with insomnia. But I would say to my patients, do you find that at nighttime when you get up and you don't sleep, you seem to be more alert, get more done, and have less pain? And they'd say, yeah. And then in the morning, you are dragging. And one of my patients said one time, you know, distraction is great. The moment I leave work and get in the car, I start hurting. I agree with that. Distraction is great. And we'll get into all that later, things you can use to help you. But the sleep thing's huge. You are chronically exhausted. And during the day, sometimes you can lay down and wipe out for hours and think, why can't I sleep like this at nighttime? Another thing, let's say you fall asleep at 11 p.m. You can wake up and feel like it's morning, and you look at the clock, and it's only 11:15. You've only been sleeping 15 minutes. Also, a lot of people have frequent urination, so they have to get up a lot. And so It sounds like a lot. It is a lot. It's a lot to deal with. And it's worse yet when people think you're faking. I used to have a patient named Rick, and Rick really loved his job, and he hated when he had to give it up because of all his health concerns. But people that didn't even know him would say things like, well, maybe you don't want to work. I know people have said that to me, and I'm thinking, what? You don't even know me. And the first time that happened to me, I was flabbergasted. I was about 30 years old. I was at a college alumni event with this lady who was about 80. And I was saying, oh, I love to garden, but it makes my back hurt. I didn't know I had fibromyalgia. And she said, well, maybe you really don't want to do it. I thought, what? Where do people get off judging? But anyway, Rick would say to me, I wish I was green. I wish I looked horrid, because I am so sick of people saying to me, well, you look fine. Now look at me today. I didn't go to bed at all last night. It's now 10 o'clock in the morning, and the night before I barely slept, and I look okay. And people will say to me, well, you look okay, but you're not. And that's hard for people to understand. They think you should look it. And so anyway, it's been a nice chat. I'll be back. I'm sorry that my talk has been divided. I think I fixed what was wrong with my iPad. So come back, join me again. And my little motto is shine, baby, shine. So shine, baby, shine. I'll talk to you again soon.